Now we come to the vaginal rings, right? Now, how many of you have really seen anybody prescribing a contraceptive vaginal ring? How many really have you seen? And how many people, let me see, how many of my students, you guys are from all over the country, okay, attending the class right now. How many of you really have seen anybody prescribe vaginal rings as a contraceptive method? At least you can write, no, not us, not me. Okay, so I can keep a count of who all have seen. Now, one more thing which I'd like to say, guys, I hope everybody has joined the chat by now. Thank you guys so much. Seen only in Viva table. Yes, true. Very interesting, Usha. So yeah, it's actually true because including me, we have not prescribed ever. And why we have not prescribed, why we're not giving, the answer is very, very simple. The reason why I take these classes and I make you answer is because, you know, in exams, everything has not to be learned by heart. Okay, there are certain things which will come automatically from your mind because your mind is so sharp during your exams. All you have to do is train it right from the beginning. Rather than, you know, learning these things, use your logic. And then whatever, see, what you do is first of all answer those questions which are very easy to answer, which you can easily answer from your own knowledge. And then the remaining points, which will only be 2 maybe, you remember 5 points out of 7 points. 2 points you don't remember. Next time when you revise, just revise those 2 points because the remaining 5 you will remember in the exam. That's a no-brainer because you, in the first place, you said those answers. So the remaining 2 points which you don't remember, all you have to do is just pay a little attention to those 2 points, right? Coming back to the topic, I'll explain you why we do not give vaginal rings, and it's very, very easy. Once you give a little bit of, attention to it, you'll understand it yourself. Now, contraceptive vaginal ring, FDA approved 2001. Transparent ring, okay, I think I had included its photo right in the beginning of the class. Yeah, this one, okay, this is transparent. It's it is 54 millimeters roughly in diameter and it's made of ethynyl vinyl acetate copolymer. It releases, how much does it, every time we are more bothered about how much it's releasing, how much it's having, it's fine, but how much does it release? It releases 15 micrograms of very low dose ethynyl estradiol. Do you see that? And 120 of etonogestrel. Okay. Now, what are the instructions for its use? I told you that it's given monthly. Okay, monthly. It's inserted at the onset of menstrual cycle. Now listen to this. Onset of menstrual cycle. That means when you're bleeding and everything, that time you have to put this thing inside the vagina. Messy? Yes. Now, COCP, as with COCPs, if this method is initiated in the first day of menstrual cycle, the woman does not require any backup method. But in case it's inserted, between day 2 to day 5 of menstrual cycle, you might need an additional backup, and you might require in this case because nobody would like to place it in the vagina at the start of the menstrual period, right? Now the instructions to use. Women is instructed to wash her hands, open the foil, remove the ring. Ring is folded like this, as you can see over here, right? Can you see this? It's folded like this in between the fingers and inserted into the vagina. It can be placed anywhere in the vagina, but high up, obviously, in such a way that when you withdraw, the ring finds it difficult to be, kind of extrude out. The ring need not be removed at the time of coitus, as it rarely interferes with coitus, obviously, because it's like a ring, right? In case the woman decides to remove it before the coitus, she should be asked to reinsert it within 3 hours for removal to maintain the contraceptive efficacy. That's also a very, very important, valid point. I would love to ask this question to my students if they are there in front of me for the Viva, and I get this, vaginal ring. Occasionally, the ring may slip out during coitus, and you have to immediately reinsert it. After, of course, kind of washing the ring with cold water or warm water, and then you have to reinsert it back because it's not any other ring. It's made out of contraceptives and hormonal contraceptives, and you have to reinsert it back for its levels to remain steady in your bloodstream. So they are being absorbed. They are having systemic effects, of course. That's the reason why all the side effects of COCPs are going to be there in anything, patches, rings, injectables, all of them, right? So, but for this, let's hear it out, guys. What will be the disadvantages of the vaginal ring over COCPs? And you'll answer yourself, why haven't you seen anybody prescribe a vaginal contraceptive ring amongst you all, and even including me in the OPD? Why we don't give? So can you please quickly write down the disadvantages? Erosion is a very good example. Yes, erosion, irritation, right? Yes, forgotten ring, not so much, guys, but yes, it's a matter of one whole month. Yes, it's a possibility. Very important. Yes, very difficult to insert. Yeah, not just, what do I say, weird. At the same time weird, but at the same time very, difficult to insert. Another very important thing, PID. Yes, vaginal irritation, vaginal discharge, because every time you're inserting something and then taking it out from the vagina and then putting it back and then taking out. What more? STD is not controlled. That's correct. That's not controlled with so many contraceptives we spoke about. Even with COCPs, it was not controlled. Even with, of course, your patches, it was not controlled. So yes, of course, I accept your point. What else? There are many disadvantages, which is the reason why you've not seen anybody prescribe it. Vaginitis, and we just spoke. It can cause problem during coitus. So removing right before the coitus, reinserting it back after the coitus, washing it every time. So many, it's very, I think, irritating to use this vaginal ring. And even more, there are 2-3 more points coming in my mind. I'm sure you can answer them as well. So there are more I need. Yeah, it interferes with coitus. Yes, true. In fact, it's more of psychological, that the female feels that, it has to be removed before the coitus. There are 2 more very important points. I'm sure you can answer them, guys. Breakthrough bleeding. Why would there be a breakthrough bleeding? If you're reinserting it immediately back, no. But yeah, if you forgot it, maybe you could not insert it that time, you inserted the next day, you can have. Yeah, okay, agreed. UTI, I wouldn't say so much, but maybe just a nidus of infection. Yeah, so many times you're just removing it and putting it back. Expulsion, very important. You know why? It's very important because every time you're taking it out and putting it inside, you might not have every time the commitment of putting it back exactly in place. Sometimes you'll just be able to put it roughly somewhere there. You feel it's snugly, put, and then you move around. And slowly you see it's coming out. You understand? And then you try to put it back again. Sometimes, it's very, very dry inside. Sometimes it's highly lubricant inside. So it might just expel out itself, especially after coitus. There is a possibility because so much lubrication, sometimes it's very dry and causes vaginitis. Yes, so these are very important points of, kind of not placing it in the right place. So it can cause expulsion as well, even with a lot of lubrication, like it happens in case of at times of coitus. Another very important point, which I just said while we were talking about the instructions of putting the vaginal ring. What was that instruction? I stopped there and then I said something, and that was one of the biggest disadvantages. Hygiene, yes, true, agreed, but you're forgetting that point, guys. I spoke when I was telling you about the instructions to put it. Let me see who was listening carefully, the class. Guys, you're my favorite, all these guys. Yeah, you have to remember to reinsert it back again in 3 hours. Yes. Yeah, agreed, Surbi. Totally. All right, I'll tell you what. You have to insert it on the first day of menstrual periods, guys. Don't you think it's very messy, very weird, very to tell a patient? Many patients who come to my OPD don't let me examine them if they are having periods. Now to tell them to put the vaginal ring on the first day of period when they're having so much of bleeding and everything, it's pretty yucky. It's pretty unacceptable. And see, all these modes of contraception that we're making for the females, right? We're making for them to make make their life a little more comfortable. And then rejection and acceptance is very important to us. So all those things which are making them accept or reject become automatically very important to us. That is the reason why we have so many basket of contraceptive available in the market, because they're all made and designed for the female to feel, confident using. And this is a very messy way, right? So that is one more disadvantage. Now do you understand? The disadvantages are so many vis-a-vis the advantages, that you have to put it once in a month and forget about it. You don't have to take it daily. That's the only advantage that's coming on your mind, or is there some more? So easy, convenient method, once a month, excellent cycle control, right? And disadvantages have been so many.